House Bill 180 is a pretty simple piece of legislation. It adds permissive language to permit the implementation of voluntary syringe and needle exchange programs. We need the legislation just so that people don't go to jail for distributing the syringes. The entity that would operate the exchange would be forced to report annually. They have to report the number of individuals using the exchange, the numbers of used needles or syringes collected, and the number of used needles and syringes that are provided.
Doing drugs is illegal, but we're going to give you a clean needle so you can do the illegal action. Is that really what we want to do?
A Johns Hopkins study recently showed that exchange programs, not needle giveaways, but exchange programs can result in up to a 4-fold increase in odds of entering detoxification. So it actually has a very much opposite effect, and it discourages drug use and gets people who need some help.
Has every member voted? Does any member wish to change his vote? The clerk will lock the machine and record the vote.
Old and used needles and syringes would be exchanged for new needles and syringes in sealed, sterile packaging. The entity operating the exchange must report annually to the Department of Health and Welfare the number of individuals using the exchange, the number of used needles and syringes collected, the number of new needles and syringes provided, and report no later than July 1st, 2020, and every 2 years after to the Senate and House Health and Welfare Committees. So what are the benefits to this program? Safe exchange and disposal of needles and syringes, reduction of needle stick injuries to first responders and those handling solid waste, reduce overdose deaths, infection prevention, and overall health cost savings in the healthcare system.
From my perspective, the rules need to be stringent enough that it doesn't encourage trading needles in the park and those kind of things that have created so many problems attracting actual drug users to come and use those facilities. So hopefully by doing this we can get the rules right and control it in such a way that this will actually accomplish, I think, what the sponsors intended, and that's to reduce the potential exposure of our public service workers and people in general in the community.
5 years later.
Idaho Harm Reduction Project posted on social media on Tuesday evening that their Boise and Caldwell offices were raided by local law enforcement. The search was related to an ongoing investigation into the distribution of drug paraphernalia, including items related to use of meth, cocaine, and opioids.
This bill repeals the needle exchange program that was established about 3, 4, 5 years ago.
The department took the rulemaking authority within the act and ran with it and perverted it into a program that was never intended to exist.
It's actually moving towards an injection site, like kind of setting those up to where Oregon and Washington have those, and those have become a nightmare.
Over the life of the program, Idaho Department of Health and Welfare reports that more than 1 million needles were collected, but 937,000 were given back out. This means that about 93% of the needles still remain in our communities.
We do not live in New York or Seattle or Philadelphia or Portland or San Francisco. This is Idaho. This needle exchange bill that originally passed in 2019, I believe it should have been repealed in 2020.
Senators, this summer I served on a Medicaid task force committee, and after one of those meetings I took off my tie and my suit coat and walked down to one of these needle exchange places. They had everything you would need to shoot up. And if you were to be driving down the freeway and get pulled over by a trooper and you had those things in your vehicle, you would be put in jail. The things that were going on in these places were not called for. It's embarrassing to think that we have money for that.
We are talking about how many people this exchange program has helped. but there's no number that shares how many have actually overdosed by using the needles that we provided them. When you look at the number of overdoses, I just seriously wonder how many of those needles that we provided causes those overdoses, and I would like to see a number of that.
I really think it just comes down to what is our role as a state. I don't think anybody's saying that a nonprofit can't do exactly what they've been doing all along. It's that conduit, that funnel of that federal money that goes into these programs that I think we need to kind of take a look at and really address. Like I said, we talk so much about the proper role of government and the proper use of our scarce resources, which is our taxpayer dollars. I ask that you think about it and support this bill. Debate is closed.
The vote count shows 27 in favor with 8 against. A majority having voted in the affirmative, House Bill number 617 has passed the Senate.